assessment of the first day of COVID vaccination? Yusek?
Yes, kami, ang assessment namin, we're content, masaya kami, nagbabakuna na po tayo, ang tagal-tagal po nating inantay, and we are now vaccinating our healthcare workers na talagang sila naman po ang pinaka-importante na mabakunahan. So nakita po namin yung uptake ng ating mga healthcare workers sa iba't ibang ospital na kumpara dun sa mga previous days na may mga lumalabas na talagang mataas ang hesitancy, we saw the support and we saw that healthcare workers voluntarily had themselves vaccinated yesterday. Bagamat yung mga numero natin ay hindi pa ganun kataas, we are expecting and we are hoping that for these coming days among the different hospitals, we will see an increased uptake of this vaccine para maproteksyonan na ang ating mga healthcare workers.
Thank you, ma'am. From Sheila Chrysostom of the Philippine Star, if the vaccines are donated, who should be accountable if there are adverse reactions? Yusek?
Yes. Sheila, according dun sa considering that all of these vaccines are under development, considering na tayo ay tumanggap at gumagamit ng isang bakuna na under EUA, ang gobyerno po ang may pananagutan para po dito sa mga adverse events na mangyayari. Huwag lang merong gross negligence talaga on the part of the manufacturer and also the healthcare worker. But with this law na bagong labas, yung tungkol po sa pagbabakuna, meron din pong clause dyan na nakalagay, there is waiving of liability against the healthcare worker, against the manufacturer, against the those officials na nag-process nito base dito sa pagbibigay natin ng bakunang ito. So ang gobyerno ang sasagot, ang gobyerno ang magpapagamot, ang gobyerno ang magbabantay, ang gobyerno ang magtutulong sa mga taong magkakaroon nito mga adverse events na to.
Thank you, ma'am. From Christine and Lika Hanapol, they're asking related questions po with regard to the breakdown of the Sinovac doses distributed in different hospitals in the country. Ma'am?
We can't give you the breakdown right now, Christine and Nika, because we are being flexible in the number of doses provided to our healthcare workers or in the different hospitals. Nagbigay po ng initial na talaan ang mga ospital kung ilan sa tingin nila base sa unang survey nila. So ang binigay po namin sa kanila at na-distribute namin ay yung ayon lang dun sa sinabi nila na kailangan nila for now. So ayaw namin magbigay ng numero sa ngayon kasi alam namin hindi final. Kasi pag biglang nag-increase ang uptake nila in the coming days, they can again request from us and we will be providing them.
Thank you, ma'am. From Christine Sabili of ABS-CBN, do these vaccines delivered to hospitals include allocation for the second dose?
Not yet, Christine. It is in Metropac. Yung second dose natin nakatago doon. So yung first dose pa lang ang binibigay natin sa kanila and then we'll have another run of distribution after.
Thank you, ma'am. Will the government be focusing more on areas with higher numbers of COVID cases like NCR and Region 7? Why or why not?
We already are. Diba? Yun pong ating sub-prioritization criteria. You remember our prioritization criteria, sabi natin may mga sectors tayo. Ito yung healthcare workers, senior citizen, yan yung major sectors na of priority. And then sabi natin, pag hindi mag-uusto sa isang sektor, magsa-sub-prioritize tayo. And ang second level natin would be the geographic burden or the burden of disease. Kaya nga po, itong unang salvo natin ng pagbabakuna, mostly yung mga ospital na binibigyan natin ay nasa National Capital Region. Kasi alam po natin na mataas ang kaso dito. Also, bibigyan din natin sa Cebu kasi alam natin mataas din po ang kaso doon. So that's part of the sub-prioritization criteria.
Ma'am, next question po. With the continued increase in cases in some parts of NCR and Region 7, do we now know what is the cause of the increase and is this linked to any variant of concern? Also related to that, Yusek, is Greg's question po. Is the B.1.351 variant the cause of the increased number of cases in Pasay or is it still premature to say such? Yusek?
Yes, the probability is always there, because there are variants detected and the cases are rising. But we need to do a thorough analysis for us to be able to really confirm and say that the variants would be the cause of this increase in cases. Kailangan namin tignan ang mga numero bago nangyari ang pagtaas ng kaso. Kailangan din namin ikumpara yung nangyayari sa isang lugar, for example, sa Pasay City na may variant compared to another LGU na walang variant. Titignan natin yung upscale or yung pagtaas ng mga kaso. Kung talaga nakikita natin na significant ba pag ginawa natin ito para masabi natin that the most probably we can say that the variants really are causing. Pero alam po natin din lahat na marami pa ring ibang factors aside from the variants. We know that the variants can aggravate. We know that the variants can be on another factor that hastens the increase in transmission. Pero bakit ba nagkakatransmission? Meron hong mga factors underlying to that, di ba? Yung ating complacency, pag nakikita nating hindi naman po sumusunod ang ating mga kababayan sa minimum health protocols, doon po sa mga lugar na nakikita namin na most of those quarantined are at home, wala po sa facility. Yun pong mga interzonal na movements, yung mobility ng tao are causing also this increase in the number of cases. So ito po yung mga paunang nakikita namin base sa aming mga pag-aaral at pag-uusap with this local government. So always remember, the variants can aggravate, but there would be underlying reasons why nagkakatransmission. At yun po yung mga sinabi ko.
Thank you, ma'am. Still from Christine Sabilio of ABS-CBN, can we get updates on the UK variant cases and the genome sequencing efforts, ma'am?
Yes, Christine, for this batch 8, meron tayong 350 samples na atin na tinest, no, for processing. At nung lumabas yung resulta, ang resulta natin ngayon, meron tayong additional na 30 UK variants, yung B.1.1.7, at meron tayong na-detect na bago na 6 na South African variants, at meron tayong na-detect din ng additional 2 na may mutations, na bago mutations, yung N501Y at yung E484K. At itong mga to, itong 6 na South African variants, 3 dito ay sa Pasay, 2 dito are returning OFs or returning overseas Filipinos from Qatar and UAE. Ang isa, bine-verify pa namin kung returning overseas Filipino siya o nandito na talaga siya at local case siya. Yung 30 natin na UK variants na bago, 20 dyan are returning overseas Filipinos. Galing sila sa Singapore, sa Middle East, at saka sa USA. Yung 7 dyan, dine-verify pa natin kung ano yung mga lokasyon nila at kung saan sila nanggaling kung sakaling returning overseas Filipinos. Yung 3 are from CAR. Okay, so that's the total of 30. Yun pong 2 mutations na nakita natin would be coming from Region 7. So ito po yung kabuuan ng ating mga naging resulta for this batch 8. Meron ho tayong ginagawang special run for this week. Ito po yung sinama natin ang mga kaso dito sa National Capital Region at saka sa Cebu. So antayin po natin, maybe towards the end of the week, we'll have results for that.
Thank you, ma'am. Next question po, can we get updates on the EUA applications? Has Sinopharm submitted its EUA request? What has happened to Gamaleya and Biotech? And what about Janssen and its clinical trials for 2 doses? Last po, why is it still being done if J&J's 1-dose vaccine regimen was already approved in the US? Yusek?
So meron tayo ngayong 3 ng aprobadong EUA, di ba? Excuse me. Pfizer, AstraZeneca, and Sinovac. Meron pa ho tayong 2 may EUA application. Ito po yung Gamaleya at saka yung Bharat Biotech. Yun pong Janssen, ang kanilang sinasabi, ang gagawin nilang clinical trial dito ay for 2 doses. And they released this statement regarding this matter. Sabi nila, while a potentially safe and effective single-dose preventive COVID-19 vaccine would have significant benefits, particularly in a pandemic setting, Janssen's COVID-19 vaccine program has been designed to be extremely thorough and driven by science. As such, we are investigating multiple doses and dosing regimens to evaluate their long-term efficacy. So ito po yung ginagawa nila, no? So ganoon naman talaga ang clinical trials. So halimbawa, may natapos silang isang clinical trial at nakapagbigay ebidensya na okay, maganda, 1 dose lang tayo. Pero syempre, they would like to further expand, no, yung yung scope ng kanilang bakuna. Kaya tumitingin naman sila kung pwede ito maging 2-dose vial, baka mas mataas ang efficacy at 2-dose regimen, baka mas mataas ang efficacy nila o baka mas tumatagal ang immunity. Yun po yung mga tinitingnan ng ating manufacturers. Kaya dito po, ang clinical trial will include 2-dose regimen. Nick, yung Sinopharm, wala pang application ng Sinopharm dito, katulad ng sabi ni Yusek Eric Domingo nung isang araw.
Thank you, ma'am. Next po from Maan Pamaran of Philstar Life. How are you addressing the vaccine hesitancy among Filipinos? What do you think will be the effect of today's vaccination program in helping to change people's minds about receiving the vaccine, Sinovac in particular?
Well, more information. Impormasyon na napaka-importante para maintindihan ng ating mga kababayan na itong bakuna na ito ay napakaligtas. Pag tinignan ho natin yung mga ebidensya na meron, talagang yung safety naman niya is not a question. Kailangan ho nating paghiwalayin yung ating iniisip tungkol sa safety at saka sa efficacy. Ang maraming mga pinag-uusapan ngayon ay tungkol sa efficacy. Yung safety po, acceptable po ang kanyang levels for safety. Etong efficacy, ang pinag-uusapan kasi yung efficacy na sinasabi nilang 50% for mild disease. Pero pag tinignan nyo yung ibang aspeto, nakaka-prevent siya ng 100% for severe infection. And that is most important for our healthcare workers. So paano po ba natin gagawin ito na tumaas ang kumpiyansa ng ating mga kababayan, especially our healthcare workers? Kahapon po nagbakuna tayo at ang ine-expect ng government, no, by highlighting and showcasing our healthcare workers being vaccinated. Lalong-lalo na po ay binakunahan kahapon ng head ng Philippine General Hospital na si Dr. Gap Ligaspi. Ang isa po sa eksperto natin si Dr. Edsel Salvania. Binakunahan din sa ibang mga ospital yung aming mga chief of hospitals. Pinapakita lang natin na tayo ay may kumpiyansa sa bakunang ito at tayo ay tatanggap dito sa bakunang ito kung sakasakali. No? So kailangan lang po na talagang more information to the public dahil sa pagkita namin sa mga town hall meetings na ginagawa natin, sa mga pakikipag-usap natin sa local government, nakikita po natin na pag nabigyan na sila ng information na ipaliwanag na, tumataas po yung rating natin para magpapabakuna na yung mga tao. So I guess we need to intensify this. And hopefully, this coming days na magbabakuna tayo sa iba't ibang ospital sa National Capital Region, makikita po ng mga tao, no, na talaga namang ang ating healthcare workers would be receiving these vaccines and hindi po ito magiging balakid, no, para matanggap din ng iba pa rin sa ating mga kababayan.
Thank you, ma'am. Red and Julia Ornedo are asking related questions po. Let me just read the question of Julia. Secretary Galvez said that delivery of Pfizer and AstraZeneca doses will be delayed further. How will this affect your goal to vaccinate 70 million people this year? And is it still achievable? Yusek?
Yung Pfizer at saka AstraZeneca na sinasabi ni Secretary Galvez, yun yung COVAX facility. Nung isang araw, tayo ay naka-receive ng official information from WHO that this more than 500,000 doses of AstraZeneca will be delivered already through COVAX facility on March 1. Kaya lang, the following day, nagpalabas uli sila ng sulat, binigay sa amin, official letter, na sinasabi nila that it might be delayed because of some supply reasons. So, tayo po ay handa ng tumanggap, naka-ready na po lahat ng mga sistema dito sa ating gobyerno. Inaantay lang po natin talaga dun sa parte nila na mapadala na nila talaga itong mga bakunang ito. So ito pong ating 600,000, i-divide nyo pa ho yan by 2 because we need to reserve the second dose of the individuals to be given by this vaccine. So we have 300,000 currently for our eligible individuals. May parating po, according to Secretary Galvez nga, meron tayong procurement from Sinovac also. At kung sakasakali, mukhang darating naman itong sa COVAX na AstraZeneca, kung makikita po natin lahat yan, maaari na po tayo makapagbakuna ng mas madami. As to the other vaccines na parating, these are all under negotiation, not because hindi pa natin natatapos ang ating isasagawa dapat sa negosasyon, kung hindi, dahil ito na po ay sa parte pa rin ng supplier because of the supply internationally. So please be informed. that the government has done our part already. We already have managed all of the arrangements here in the country. Ang tanging inaantay po talaga natin ay makapagkaroon ng commitment ng manufacturers as to the specific time of deliveries owing to the fact na meron nga pong supply shortage sa buong mundo.
Thank you, ma'am. From Lay Alves of GMA News, may impasse na rin ba sa negosasyon sa pagitan ng gobyerno at Pfizer? Ano na ang ginagawa na pamahalaan kaugnay dito?
Yes, Lay, as soon as the law na merong indemnification was approved and enacted, tayo na po ay nakapag-usap na uli sa COVAX facility regarding this indemnification agreement, no? Para dito sa Pfizer doses ng COVAX facility. So apparently, according to Secretary Galvez naman, ito ay hindi darating agad, itong Pfizer na to. Pero mga siguro second quarter, early second quarter, ay makuha na natin itong Pfizer through COVAX facility. Pero ang announcement naman, kahit dati pa, itong Pfizer ay mga third or fourth quarter pa yung ating ipoprocure sa kanila.
Next po, Yusek from Greg Gregorio, saying that the South African variant may affect vaccine efficacy. This may even lessen Sinovac protection against mild infection. How would you allay sustained concerns regarding this matter? Yusek?
Yes, Greg. Ako, tingin ko and this is my opinion, 50% efficacy is better than nothing. This is for mild disease. Pero yung 100% na hindi na ako mauospital, hindi na ako natatakot araw-araw pagka ako'y pumapasok sa trabaho na magkakasakit at ma-ICU, that is so much for me already. So ito pong sinasabi ko lang ay because of these variants na sinasabi nila that can affect the efficacy of the vaccine. Ang lagi po natin tatandaan, hindi lang naman po yung bakuna ang magiging protection natin laban sa sakit na ito. Tuloy-tuloy pa rin ang ating minimum public health standards. So kailangan pa rin po na talagang mag-comply tayo strictly, lalong-lalo na ngayon na may variants tayo na detect. Please comply with the minimum health protocols. At yung sa mga bakuna naman po, bumababa man ang efficacy base sa pag-aaral sa ibang bansa, nandyan pa rin po. Hindi naman niya sinabing wala na talagang bisa ang bakuna. So ibibigay pa rin po natin ang bakuna kahit may mga ganitong ebidensya na.
Thank you, ma'am. From Greg po, as well as from Sheila, they're asking related questions po if there is a need to reconsider new protocols for travelers now that we have the SA variant and more UK variant and mutation of interest.
Wala,
Yusek?
pag-uusapan yan, Sheila and Greg. Nung nagdesisyon na magkaroon ng revised protocols for incoming travelers, may UK variant na po noon, no? Ito pong ating mga sinagawang risk classification nung huli rin, meron na rin po tayong variant. So what am I saying? Hindi po pwedeng sa bawat dagok na or sa bawat challenge na we are going to face, we will restrict lagi, no? Hindi lang po 'yan ang strategy to respond to this pandemic. Marami pa po tayong pwedeng gawin. Although tama po kayo na dapat ay meron po tayong konsiderasyon doon sa mga pumapasok sa ating bansa. Kaya nga po napaka-stricto naman, even though we have revised the protocol, yung protocol na pag pumasok sa ating bansa has to quarantine, has to test on the 5th day, and has to be properly endorsed to the local government. So nag-flag na po kami sa DILG na dapat yung endorsement at saka yung pagka-quarantine doon sa local government after nilang magstay doon sa hotel for at least 7 days ay maisagawa pa rin because you would like to make sure na naka-quarantine sila at wala na pong papasok na ibang variants ito sa ating bansa. So everything is being considered, pero kailangan natin maintindihan na hindi lang po yung lockdown o hindi lang po yung closing of the borders ang pwede nating masagawa para po malimitahan natin ang pagkalat ng mga ganitong variants.
Thank you, ma'am. Those are all the questions that were submitted yesterday. I'll be asking the questions po that were sent in the chat. I'll start po with the question of Gaya Kabiko. She's asking kung ilan po yung target natin for vaccination every day now that the vaccine is already here. Yusek?
Yes. Yes, thank you for that. No, so we have an initial target, but based on the surveys nga that we have received from each of the hospitals, medyo mababa yung kanilang pinapasok, no, na nag-accept pa sa bakuna sa ngayon. So ngayon, we open it for each hospital to target. So binigyan namin ng laya or binigyan natin ng authority ang hospitals to set their own targets per day. And they have their own targets at doon namin din binase kung ilang bakuna ang ibibigay namin sa kanila. So bawat ospital, meron silang different targets. Hindi tayo pinagkapare-pareho.
Thank you, ma'am. From Red Mendoza of the Manila Times, may tips daw po ba ang DOH on the practices before vaccination? Kasi a vaccinee daw po at veterans bike papunta sa hospital, making him a bit tired before he has taken the vaccine, kaya siya nagkaroon ng mild effect. Yusek.
It's actually read, wala naman talaga no na hard and fast rule na pag sinabi na dapat ikaw well rested and all. But of course, we consider the human body. Ang katawan natin kapag binibigyan ng mga ganitong klaseng gamot o bakuna, iba-iba ang ating nagiging nararanasan o iba-iba ang nagiging reaksyon natin. So there may be some people kahit matanda na sila o may sakit sila, pag binigyan niya ng bakuna, walang epekto, okay sila. Meron namang iba, very, very sensitive. Nag-rashes, sumakit yung braso, sumakit ang ulo. Yan, katulad niya na bisikleta, parang lalo siyang nagkaroon ng mga ganitong pakiramdam. So, hindi po natin matatansya kung ano ang mangyayari sa bawat isa sa atin. But what I'm trying to say would be, siguro mas magaling, bago tayo magpabakuna, unang-una kumain tayo ng tama. Huwag tayo magpalipas, no? Eat your breakfast if it's in the morning or eat your meals. Then have a good night's rest before the vaccine day. Then third, alam ko po yung iba kasi may takot eh. Kaya sa tingin ko kahapon marami yung anxious, yung tumataas yung BP, sumakit yung ulo, katulad niya nagbisikletana, nahilo. So may mga anxiety or fear related no na mga simptomas kahapon na nakita namin which we have validated. Dapat medyo relax lang po tayo. Wala tayong dapat ikatakot sa iniksyon. No? Masakit ng konti, parang kagat ng langgam, pero after that, nothing anymore. And wag din tayo matakot na magkakaroon tayo ng adverse reactions kasi napaka mild po ng ibibigay ng mga reaksyon nito kung sakali and napaka-uncommon. Hindi siya commonly nangyayari. Napakaliit ng porsyento na kayo ay magkakaranas ng ganitong adverse events.
Thank you, ma'am. From Lay Alves, may we get a statement kung wala pa rin pong community transmission ng variants of concern dito sa Pilipinas?
We cannot say that yet because we can still find linkages across or among specific individuals. No, although there are still some individuals na atin pang pinag-aaralan kung saan galing at kung ano yung link niya, pero sa ngayon, we cannot say yet na meron tayong community transmission. Meron tayong local transmission sa Pasay at sa CAR.
Thank you, ma'am. From Aiko Miguel, what is the difference between the B.1.7 and the B.135 variants when it comes to their transmissibility?
Both has higher transmissibility, Aiko, the B.1.1.7 or the UK variant, and yung ating South African variant, pareho sila base sa pag-aaral at saka ebidensya, pareho silang mas nakakataas ng transmission, no? So mas nakapanghahawa. Pero itong South African variant, meron siya pang isang component or isang mutation na nakakapag-effect or nakaka-apekto sa vaccine efficacy, yung tinatawag nilang immune escape. So itong South African variant ay mas binabantayan dahil dito sa phenomenon na nangyayari sa kanya na ganito. So kaya nga gusto natin as much as possible, fast containment tayo nitong variant na to so that we can prevent it to further spread.
Thank you, ma'am. From Donna Pazibugan, she's asking, on the need for information, there's the clamor among medical workers to release Sinovac's late-stage clinical trial data that was not published in journals. Will the FDA release these data?
The Food and Drug Administration doesn't have any authority at all to publish data that are not theirs. This data that has been submitted to them was a requirement coming from was a requirement submitted by the manufacturers. But the FDA do not own this data. Sila po ay nakabind din, although there are no agreements to this matter. Pero ang ating regulatory authorities, bounded sila no, na kailangan ang mga dokumentong sinasubmit sa kanila, hindi nila yan na-share kahit kailan. Manufacturers have that right. And the Sinovac manufacturers ang may karapatan po mag-publish o hindi mag-publish. No? Nasa kanila po yung ball na yan. Although, nung time na nag-evaluate tayo, tayo po ay nakapag-usap sa kanila. We undertook a certificate of we had a certificate of undertaking, no, between our experts and the Sinovac manufacturer and the FDA, so that we can get a hold of this data of theirs para mapag-aralan ng ating HTAC, ng NITAG natin, para makapagbigay sila ng tamang rekomendasyon.
Thank you, ma'am. From Sheila po, Yusek Verheri mentioned earlier that people undergoing home quarantine could be contributing to cases. Ano na po ang gagawin para ma-address ito? Yusek?
Well, we're extracting people from the houses, no? Diyan sa Pasay, no, nag-umpisa po tayo last week, tayo po ay tinutulungan ng DILG at saka ng One Hospital Command, and of course, our local government officials. So pinabuksan po yung Philippine Village para maging quarantine facility rin na paglalagakan, at meron din naman silang malalaki ring mga quarantine facilities surrounding their area, doon po natin dinadala. So yung parang Oplan Kalinga na nangyari dati, yun din po ang ginagawa natin ngayon sa City of Pasay.
Thank you, ma'am. From Christine Sabilo, she's asking, pwede po bang makakuha lang na explanation ulit on herd immunity? Ilan na po ba sa ngayon ang data dating abutin sa population, and may bago po ba tayong target month for herd immunity? Sabi kasi ni Secretary Galvez, moral obligation ang vaccination sa ngayon to reach herd immunity. Yusek?
Yes, Christine, ang herd immunity is reaching a certain portion of your population that has been vaccinated, so that you can say that the total population is already immune from the disease. For example, para natin, pineg na 70% of the population of the Philippines should be vaccinated for us to confer that herd immunity. When you say it's herd immunity, it's the total population immune from a certain disease. So kailangan lang nating umabot dun sa 70%. Now, moral obligation, yes, it's a moral obligation, because if everybody gets to refuse, and then the herd immunity will not be achieved, and therefore transmission of the disease will continue on in the country. Kaya nga po, pag naghihikayat tayo sa ating mga kababayan, sinasabi namin, wag na ho nating isipin muna ang ating sarili. Isipin din po naman natin yung ating pamilya, isipin po natin yung komunidad, kasi as long as there are people refusing to get vaccinated, hindi po natin lumalayo ng lumalayo yung ating target, at lumalayo ng lumalayo yung ating tsansa na maka-achieve nitong herd immunity na sinasabi natin. Pero let me just qualify, Christine. Itong herd immunity is our long-term, our end-term goal. Pero ang atin ngayong tinitignan na very objective of why we would want to vaccinate as soon as possible is for us to reduce morbidity and to reduce mortality, owing to the fact that the specific mechanisms of these vaccines are to lessen the chances of severe infection, lesser the chances of hospitalizations, and therefore, nakakabawas sa mga namamatay, nakakabawas sa mga nagkakasakit, nagkakabawas sa mga hospitalization. So that is the early on objective, but of course, our long-term goal is herd immunity.
Thank you, ma'am. From Greg Gregorio, he's clarifying lang po, did you mean local transmission of South African variant in Pasay? Yusek?
No, the UK variant, we have a local transmission in CAR. And just yesterday, we had that information that there was this linkage between these two individuals with the South African variant. So, yun po ang tinitingnan natin ngayon, na baka dyan sa Pasay may local transmission din.
Thank you, ma'am. Leigh Alves po is asking if you can explain lang po ang immune escape. Yusek?
Well, the immune escape would be that halimbawa meron tayong insult katulad niyang variant sa isang tao at binigyan ka ng bakuna. Instead that your antibodies will be working for you against a specific disease, hindi niya magagawa iyon because of the effect of this variant. Kaya sinasabi nila na makakabawas sa efficacy ng isang bakuna because naapektuhan nga nitong mekanismo para mag-produce ng antibodies, itong variant nakakaapekto dun sa process na yon. So, kaya ang babala, ang sinasabi ng ebidensya na itong South African variant may affect the efficacy of the vaccine because of this phenomenon.
Yusek, in relation to that, what happens po to an individual when there's immune escape? From Aiko Miguel po.
Well, base dun sa mga pinag-aralan Aiko, no, at lumabas naman yan sa mga datos sa international evidence, bumaba yung efficacy ng vaccina. Instead maybe of giving them, for example, 100%, hindi ko kasi matandaan yung datos specific. Pero bumaba yung efficacy ng bakuna to a low number, no? Not really baseline zero, no. Bumaba lang, no. So ibig sabihin nababawasan yung talab, nababawasan yung protection na pwedeng ibigay sa ng bakuna because of the effect of this variant to specific vaccines.
Thank you, ma'am. From Sheila Crisostomo, if you can elaborate daw po on the Pasay local transmission, how many cases, SK or UK variant? Yusek?
No, let's clarify this. We have a local transmission of the UK variant in CAR. In Pasay, we are still trying to validate. Pero kahapon, meron tayong information na may link yung dalawang kaso na may South African variant yan sa lugar na yan. So, hindi pa natin idinideklara na official na local transmission yung sa Pasay. But in CAR, for the UK variant, yes, we have local transmission there. And we have officially announced that already before. Just to clarify, please do not misinterpret us.
Thank you, ma'am. From Christine Sabili of ABS-CBN, yung sa adverse event na nag-rashes, malalaman po ba kung allergic siya sa bakuna ng Sinovac? Hindi po ba sinabi na walang allergic reactions ang Sinovac compared to other vaccine brands? Posible po ba na sa ibang components ng vaccination instead sa bakuna mismo? Yusek?
Yes, Christine, yung sinasabi na walang allergic reactions, wala naman ganun. Ano? So lahat ng na mga foreign things na papasok sa ating katawan, nandun lagi yung posibilidad na pwede tayo mag-reaction. Katulad ng pagkain, katulad ng mga gamot, katulad ng bakuna. Pero ang Sinovac, sinasabi nila, yung chance mo na magka-allergy ka would be minimal because it doesn't contain this polysorbate na nagko-contain dun sa ibang mga bakuna na meron ngayon. Kasi itong polysorbate has been identified through evidence and scientific process na siya yung nakakapag-cause ng reactions na severe allergic reactions dun sa ibang bakuna. Kaya lang nga, ang Sinovac, wala siyang ganito. Kaya sinasabi nila, yung allergic reaction or severe allergic reaction na sinasabi, napakaliit ng tsansa na magkakaroon para dito sa Sinovac. Now, when it comes to this individual, kung talagang dahil sa bakuna yung kanyang naging reaksyon, ito po ay pinag-aaralan. Kaya po tayo merong National Adverse Effects Events Following Immunization Committee or the NAFIC at saka yung RAFIC natin. Kasi lahat po ng papasok, even though minor yan na event, tinitignan po nila yan at pinag-aaralan kung talagang dahil sa bakuna o hindi.
Thank you, ma'am. From Rafael Bosano, posible po ba na mag-mutate ang virus to locally to become exactly the same as the SA variant? Kung dalawa po ang ROF and if ever they are not from Pasay, how is it possible for others in the area to get the variant aside from mutation?
Yes, Rafi, yun ang ating pinag-aaralan sa ngayon, ano, kung saan ang galing. Saan ang galing, ano? Yun po ang una natin laging hinahanap, yung source of infection. That's why we do also contact tracing. We backtrace, we look at the dates when they were infected. We look at the dates when people arrived in the area para makita natin yung kompletong picture at masabi natin galing ba talaga to sa abroad, galing ba to kung saan, at makapagbigay tayo ng tama na response. So ngayon, Rafi, pinag-aaralan pa lahat yan. We can't say yet.
Thank you, ma'am. From Julia Ornedo as well as from Claudette, they're asking related questions po. If we have data available on how many doses were not taken up by health workers yesterday.
There was a target and based on the target, katulad sa PGH, they exceeded their target. Yung doses, baka magkamali po kayo sa pag-interpret pag yan ang ginamit nyo kasi binigyan po sila ng doses which were more than enough dun sa sinasabi nating target. Halimbawa, for example lang, ang isang ospital, 1,000 ang sinabi niya, binigyan kita ng 1,200 para kasama ang wastage mo dyan. So wag niyo hong gamitin din ang number of doses para hindi kayo magkamali sa interpretation.
Thank you, ma'am. From Greg po, if we have data available po as to which hospitals po yung 13 adverse events?
Pwede ba natin ibigay yun? Sige. Mamaya siguro, no? They will provide you a table later. We'll just get the clearance if we can release this type of information kasi under investigation siya by our NAFIC and RAFIC. We'll let you know.
Thank you, ma'am. From Karen Lema of Reuters po, Yusek, just to clarify po, the 6 South African variant cases are the first to be detected in the country po.
Yes, Karen, no? Ito yung pinakauna na nakaka-detect tayo ng South African variants. Nung mga previous batches, nung ating mga genome sequencing, UK variant lang yung nadedetect natin at saka yung mutations, no? Additional mutations. Pero wala pang South African variant. Ngayon lang talaga.
Thank you, ma'am. Last two questions po from Aiko Miguel. Follow-up lang daw po, Yusek. Does this mean if Sinovac is given po to an individual, SA variant can lessen the protection the vaccine can give because of immune escape? May recommended vaccines na po ba for SA variant?
Marami ang nagpapalabas ngayon, no, ng mga ebidensya. Katulad sabi nila, ang Johnson and Johnson daw, apparently, based on evidence, pinapakita that they can address, no, the effects of these variants in variants of concern na all over the world. Sabi din nila, itong ibang mga bakuna na meron ay nakaka-address dyan. So kailangan ng mga patuloy na pag-aaral ukol dito, no, kasi hindi pa natin talaga sigurado kung ano talaga yung mga bakuna na maari talagang lumaban at ma-maintain ang efficacy ng bakuna with these specific variants in question. So itong sa Sinovac, wala naman silang pinalalabas pa na pag-aaral kung sakali na kung may variant, no? Kaya naman nagkaroon ng magaganda o mga datos, no, itong mga manufacturers like Johnson and Johnson kasi doon sa ginagawa nila ng trial ay may biglang outbreak, no, or tumaas ang kaso because of these variants. Kaya nakasama sa trial, nakita nila tuloy yung epekto. Pero for these other vaccines na ginagamit, hindi pa nila siguro nasusubukan dun sa mga lugar na may mga variants. Kaya wala silang masasabi kung ito ay maapektuhan o hindi maapektuhan. Pero syempre, ang ginagamit natin sa ngayon na assumption would be yung mga nangyari na sa ibang bansa na sinasabi nila na higher transmission, maari na makaapekto sa efficacy ng bakuna.
Thank you, ma'am. Last question po for today. Gaano po ba karami yung initial target ng DOH for vaccination before it decided to have hospitals set their own targets? Ilan po ba dapat yung mabakunahan per day to inoculate 70% of the population this year?
Well, we were thinking when sa plano, okay? Sa plano, hindi yung actual. 300 for 8 hours, 900 if you go 24 hours. So you multiply the 900 by 7, that would be 50, 54, 540, 5,400. Mga ganon na individuals per week per hospital. Eh, hindi ka naman naabot ng 5,400. Ang ibang ospital, meron lang 600 na healthcare workers kasama ang personnel. Meron naman katulad ng PGH, of course, napakalaking institusyon. Ang dami, almost 5,000. Okay, so ito ay depende sa magagawa at ilang vaccination areas, ilang vaccination teams ang meron sa isang ospital. So sa ngayon, nagbigay lang na mas mababang target ang ating mga ospital, not their real target, dahil alam naman po natin yung naging hirap or challenge natin because of this vaccine. Pero nakita naman natin na slowly nag-shift ng ating healthcare workers, and I think the recipients would be more for today and the coming days.
Thank you, ma'am. Those are all the questions we can accommodate for today. Ma'am, your final message before we end today's forum. Salamat po.
Thank you, Nick. Thank you to all of you. Salamat din kahapon sa pagsuporta at pakikipag-align nyo sa amin dun sa ating mga assignment for our ceremonial vaccination. So sa panahong ito, napakahalaga po ang nakakaisang kilos pagkat dito po sa mga padating na mga bakuna, hindi lamang po ito hudyat ng bagong pag-asa for all of us, kung hindi yung pagpuksa ng pandemya. Lagi po nating sinasabi, no, kahapon pa nag-uumpisa na ho tayo magbakuna, we are vaccinating and we have waited for so long for yesterday and even this coming days na talagang meron na pong mabibigay na protection, hindi lamang po sa ating healthcare workers, kung hindi po para sa buong sambayanang Pilipino. So humihingi lang po sana kami ng pakiusap, makiisa po tayo. Sana po we spread the correct information to continuously improve confidence of our kababayan dito po sa mga bakunang parating sa ating bansa. Maraming salamat po and good morning to all of you. Thank you, Nick.
Maraming salamat po, Yusek.